With Eve today. She is a nursing student at Auburn, and she has a few questions for me about a topic that she's studying.
So, what is osteomyelitis?
Well, osteomyelitis is a bone infection. It can be caused by bacteria or fungus, most commonly bacteria, and most commonly Staphylococcus aureus. It's rare. It only affects 2 out of every 10,000 people. If untreated, osteomyelitis can cause death of the bone tissue, which at times can lead to a need for amputation.
So, what are the risk factors for osteomyelitis?
Well, osteomyelitis can affect people of all ages. However, there are certain people that are at an increased risk for developing osteomyelitis. And these include people with diabetes, IV drug users, the elderly, people that are on hemodialysis, those with weakened immune systems, and those with sickle cell disease.
So, where in the body can osteomyelitis occur?
Osteomyelitis can affect any bone within the body.
Can you explain the pathophysiology of osteomyelitis?
Sure. Various microbial agents can cause osteomyelitis. It can occur in a number of ways: an open injury with exposed bone penetrating skin, trauma that causes a blood clot to form around the bone that leads to a secondary bacterial infection, bacteria in the bloodstream, which is known as bacteremia, which deposits in a local area of bone, or chronic open wounds like pressure ulcers that eventually extend to the bone surface.
What about clinical manifestations?
Well, we often see pain in the affected area, swelling, redness, warmth of the infected area, nausea related to the infection, discomfort, a general feeling ill, drainage, which is usually pus, sweating, chills, and we also often see a decrease in loss of joint motion, just depending on which bone is affected.
So, how is osteomyelitis diagnosed?
There are multiple tests that can diagnose osteomyelitis. They include X-ray, MRI, lab work, which specifically checks the white blood cell count for infection, blood cultures, needle aspiration, bone scans, and biopsies.
And how is osteomyelitis treated?
Well, there are several treatment options. One is drainage if there's an open wound or an abscess present to drain that area. Antibiotic therapy is also typically used, and surgery as a last resort to remove the damaged bone.
Awesome.
Does that help some?
It does. Thank you so much for
You're
answering my
welcome.
questions.
All right. Well, thank you guys. We hope this was helpful to you too. Have a great day.